Hello friends, in this lecture we are going to discuss about the glucocorticoids. Let's get started. The functions of the glucocorticoids. Now as far as the glucocorticoid is concerned, remember that the glucocorticoid or cortisol has a two type of function, right? One type of function is basically related with the metabolism. Another type of the function is responsible to resist or to prevent stress. And without this second function, resistance, that is provided to stress, the person will die due to very minor illness or stress. So glucocorticoid are not essential for life, rather glucocorticoid is important for long continued life, while on the other hand mineralocorticoid are important or essential to just barely life, right? While in the glucocorticoid is important to fight against stress and minor illnesses, so it is important for long continued life. Now all the glucocorticoid effect, 95% of the glucocorticoid effect is basically the cortisol. It is also known as a hydrocortisone. It is the end product that we discussed in our previous lecture of a glucocorticoid pathway, and remaining will be provided by corticosterone. Now if you guys do not know what is corticosterone, go through the synthesis of the steroid hormone lecture. In that lecture, this corticosterone will be provided in a pathway that is eventually synthesized a mineralocorticoid, right? So it is intermediate product of the mineralocorticoid synthesis pathway, and yet that corticosterone has a 5% or 5 to 10% of a glucocorticoid action as well. Remember that, it is very important once we discuss about the deficiency of different enzyme in applied aspect. So let me repeat one more time. Glucocorticoid, the cortisol, that is the end product of a glucocorticoid pathway, will basically responsible for 95% of the glucocorticoid activity, and corticosterone, that is actually a intermediate product of mineralocorticoid pathway, it basically responsible for the remaining glucocorticoid activity. Now here's the catch: if by somehow glucocorticoid do not produce, let's say in 11 hydroxylase deficiency, this corticosterone is yet able to produce in mineralocorticoid, and because of the higher amount of this corticosterone, ultimately we see glucocorticoid activity, or rather higher amount of glucocorticoid activity, right? That we discuss in our applied aspect once we discuss about the deficiency of the 21 hydroxylase or 11 hydroxylase enzyme deficiency. Now effect of the let's discuss about the effect of the glucocorticoid in detail. So let's enumerate in which heading we are going to understand the effect of glucocorticoid. So these are the headings: effect on metabolism, effect on muscle, effect on bone, on GIT, on connective tissue, on blood cells, and on fetus. So if in exam, if a glucocorticoid is asked for a long question, you need to write it down, effect of glucocorticoid on all this tissue. And as far as the metabolism is concerned, three metabolism is most important, as you guys already know: protein, carbohydrate, and fat. So let's discuss the metabolism, the effect of glucocorticoid on metabolism. Let's discuss first the carbohydrate. Now effect on carbohydrate is basically conserve carbohydrate. As I told you very frequently, that hormone that starts with the G, 95% of the cases it will eventually increase the carbohydrate, right? For example, growth hormone, then glucagon, glucocorticoid, right? Now how it will conserve carbohydrate, how it will increase the blood glucose level? So the answer is, first thing it will do, it will increase glucose synthesis. Most of the effect of the glucocorticoid is same as growth hormone, so do not try to remember two things differently. Most of the action, let's say 90 to 95% of the action, is similar over the carbohydrate of growth hormone as well as glucocorticoid. So first thing it will do, it increase glucose synthesis. What is known as stimulate gluconeogenesis. It synthesize new glucose from non-carbohydrate source. So what are the carbohydrate source? What are the non-carbohydrate source? It is amino acids. So In order to synthesize more amount of glucose, what glucocorticoid will do, it will increase the mobilization of the amino acid from the muscle. Right? Now amino acid are present inside. Now amino acid will be catabolized from the muscle. Sorry, the protein will be catabolized from the muscle and eventually release the amino acid. And that amino acid will enter inside the liver, and inside the liver there is a synthesis of glucose, right? So in order to convert amino acid into the glucose, they require particular enzyme. So what glucocorticoid will do, it will eventually increase the enzyme required for this conversion. And the last one, if it antagonizes the effect of insulin over the decreased gluconeogenesis. You see, by increased glucose synthesis, it eventually increase the blood glucose level. That will leads to more amount of insulin release, and that more amount of insulin will eventually decrease the gluconeogenesis. That thing we do not know, we don't want in glucocorticoid metabolic effect. So what glucocorticoid do, it will antagonize the effect of insulin over gluconeogenesis. So what is the effect of insulin over the gluconeogenesis? It will decrease the gluconeogenesis. So by antagonizing the effect of insulin, glucocorticoid will eventually increase glucose synthesis. Now this is all about glucose synthesis. Second thing this glucocorticoid do is similar, that it will as the growth hormone, it basically decrease the glucose utilization of the cell. How it will decrease the glucose utilization of the cell? Basically it decreases the entry of the glucose inside the cell. Now in order to enter glucose inside the cell, basically the muscle, adipose tissue, it and heart, we need a particular transporter that known as a glucose transporter. And the main transporter or GLUT transporter that is responsible for entry of the glucose inside the muscle, that is GLUT4. So in order to decrease uptake of the glucose, what glucocorticoid do, it will decrease the translocation of the GLUT4 inside a cell, over the cell membrane of the muscle. Second thing, this glucocorticoid will do insulin resistance. Now what is insulin resistance? Insulin resistance is that there is a presence of insulin, yet insulin is not able to act. So how it will do insulin resistance? It decrease the expression of insulin responsive substance 1 and PI3 kinase. What it will do? The glucocorticoid will decrease the substrate insulin responsive substrate 1 and phosphatidyl inositol 3 kinase. Now this IRS has a 1, 2, 3, 4 subtypes. For glucocorticoid will work over IRS1. Now this IRS1 and phosphatidyl both are involved in the glucocorticoid, this insulin action. So this is all about the effect of glucocorticoid over the carbohydrate in single slide. Now via this slide you can easily imagine what will happen when there is excess glucocorticoid, right? This is the effect of glucocorticoid, that it will increase glucose synthesis and decrease glucose utilization. So what would be the result if there are more amount of cortisol present in free form or in the circulation? That is about applied aspect, right? So let's discuss that applied aspect along with the effect of glucocorticoid. So in somehow once we approach the applied aspect, it is very easy to remember and understand. So what will happen if there is an excess amount of cortisol? Obviously there are more amount of glucose inside the circulation, that is hyperglycemia, and insulin is not able to act. So basically it do glucose intolerance. Our body cannot decrease glucose level as it should be, and that condition is known as diabetes mellitus. So in excess amount of cortisol, it will lead to glucose intolerance and diabetes mellitus. These are the clinical features of the higher amount of cortisol. That is known as Cushing's syndrome. Remember the term, Cushing's syndrome, right? That we discuss in our applied aspect. Now the diabetes mellitus that is done by glucocorticoid, it is known as adrenal diabetes. So what is adrenal diabetes? So if in comment, if someone asks you in comment that what is adrenal diabetes, what you should write it down, you have to write it down in this fashion. Glucocorticoid will increase the rate of the gluconeogenesis and decrease the rate of glucose utilization. So ultimately it causes increased blood glucose concentration. So once the glucose concentration is in the higher amount, there are increased insulin secretion. Now, as I told you in earlier slide, glucocorticoid will do insulin resistance, right? So high amount of glucocorticoid eventually decrease the insulin sensitivity over the skeletal muscle and over the adipose tissue. Now, as I told you in our insulin lecture, that insulin is basically responsible for uptake of glucose in three tissue mainly. One is heart, then muscle and adipose tissue. Remember HEMA, I told you in that lecture. H stands for heart, A stands for adipose tissue, and M stands for muscle, skeletal muscle. So blood glucose level is increased more than 50%, and that condition is known as diabetes, and it is due to the adrenal cause. It is known as adrenal diabetes. So in that diabetes, if you give insulin to a person, it is not effective. Got it? Why? Because glucocorticoid is already higher side in this adrenal diabetes patient. So if you give more and more amount of insulin, that insulin is not going to work. So you have to cure the root of a disease, that you have to set the glucocorticoid level over the normal side. This is all about the effect of glucocorticoid over the carbohydrate. Now let's see the effect of glucocorticoid over the protein metabolism. Now in order to increase gluconeogenesis, it increases the availability of the raw material. That raw material is amino acid. So in order to get more amount of amino acid, what glucocorticoid will do, it will increase the amino acid mobilization from the muscle, basically for the gluconeogenesis, right? This is about the extrahepatic action of glucocorticoid. See, let's divide the action of glucocorticoid over protein in two. One is hepatic action, that is action of glucocorticoid over liver. Another one is extrahepatic, that is muscle. So basically what glucocorticoid do to the skeletal muscle or to extrahepatic protein, it will decrease the extrahepatic protein. That terminology is given in guideline, extrahepatic and hepatic. So in order to decrease extrahepatic protein, what glucocorticoid will do, it will increase catabolism and decrease protein synthesis. So it makes sure that there are more amount of amino acid is available for gluconeogenesis. So as the protein metabolism will take place, it will increase amino acid mobilization, and these amino acid will enter inside the liver. So what happens to the protein that is synthesized by liver? It will increase hepatic protein and plasma protein. So it increases transport of the amino acid into the liver and eventually increase protein synthesis. So there are two type of action over the protein metabolism. Do not confuse with it. This single slide show you increase protein and decrease protein by glucocorticoid. Remember that glucocorticoid has a two type of action over protein metabolism. One action is over the hepatic tissue, that is liver. Another action is over the extrahepatic tissue, that is muscle. What it will do to the hepatic protein? It will increase protein synthesis. What it will do to the extrahepatic protein? It will decrease protein synthesis and increase catabolism. So again, as far as the applied aspect is concerned, what happens whenever there is excess cortisol? So there are more amount of catabolism. So muscle become weak, as is shown in this diagram. Muscle become weak and myopathy will occur. That's why I picked this picture. Now, how cortisol will increase hepatic protein? So it increases the amino acid transport in the hepatic cell or the liver cell, and it will use for synthesis of a protein. So it is very basic diagram that is shown over here. More amount of protein catabolism over the muscle, and eventually person will lose the muscle protein, and this muscle protein will catabolize into amino acid, and that amino acid will eventually enter inside the liver, and it will also increase the enzyme in the liver for the protein synthesis. So basically it eventually increases the formation of the plasma protein, and some of the amino acid is converted into the glucose as well in gluconeogenesis. So cortisol basically increases the protein synthesis in liver. Now one more thing, the effect on connective tissue. Now cortisol basically inhibit the fibroblast proliferation and the collagen formation. Cortisol inhibit the fibroblast proliferation and collagen formation, and both this thing will be responsible for the actual tone of the skin. So in excess cortisol, what will happen, it eventually causes thinning of a skin, and once the skin become very thin, it will be easy to stretch. So you can see a stretch mark over the skin. It is the hallmark or the diagnostic feature of a Cushing's syndrome. It is known as abdominal stria. Got it? So cortisol basically inhibit the fibroblast proliferation. So normally it should not normal level, it does not inhibit the fibroblast proliferation. But once the cortisol in very higher amount, in excess amount of the cortisol, it will lead to the stretch mark over the abdomen that is shown in this diagram. It is known as stretch mark. And the thinning of the capillaries. So it also decreases the easy to get bruise. This is all about the effect on connective tissue. So in Cushing's syndrome, in excess amount of cortisol, these two is the clinical feature. One is the abdominal stria and another one is the easy bruising. Now effect on fat metabolism. Now what cortisol do? Cortisol will use fat for the energy. Again the action is similar to the growth hormone. It increases use fat for the energy. So basically glucocorticoid will do lipolysis. Now by lipolysis it will mobilize the fatty acid from the adipose tissue. Let me show you in a diagram. See, this is the one glycerol molecule, and this glycerol molecule has a 3 chain attached to it. These 3 chain are the fatty acid. So this entire molecule, 3 fatty acid chain along with the glycerol, it is known as a triglyceride. Got it? Now in order to get lipolyzed, this 3 chain of a fatty acid will be dislodged from this glycerol molecule like this. Got it? And this free fatty acid will eventually enter inside the blood circulation, right? So the enzyme responsible for the cut down of this bond between glycerol and this free fatty acid, it is hormone sensitive lipase. Yes, it is hormone sensitive lipase. And in order to get lipogenesis, the hormone responsible for attachment of the 3 fatty acid with the glycerol, that enzyme, the responsible for this is a hormone sensitive lipase. I am not going to tell you about the lipoprotein lipase because it gives this picture complicated. Now in this diagram, just remember that by somehow cortisol will stimulate the hormone sensitive lipase. That hormone sensitive lipase will eventually cut down the bond between triglyceride and glycerol, fatty acid and glycerol, and eventually fatty acid get released inside the bloodstream. Got it? So what it will do, it will increase free fatty acid inside the plasma, and this fatty acid will utilize for energy, and also increase the oxidation of the fatty acid inside a cell. Got it? Now how cortisol will increase lipolysis, that we discussed already. Cortisol will decrease transport of glucose into the fat cell by inhibiting the GLUT4, that we already discussed in our effect of glucocorticoid over carbohydrate metabolism. It will decrease the expression of the GLUT4. So by decrease expression of the GLUT4, it will decrease the transport of glucose into the fatty acid. So the glycerol that we need in order to synthesize triglyceride, it is not present because it is basically derived from the glycerol. That glycerol has a name known as alpha glycerophosphate. The glycerol that is written over here, in order to lipogenesis we need glycerol. So by decreasing the glucose transport, there are less amount of glucose available inside the adipose tissue that get converted into the alpha glycerophosphate, and that glycerol is required for both the thing, for deposition and maintenance of the triglyceride. So in absence of the glycerol or alpha glycerophosphate, fat cell begin to release fatty acid. Got it? Now what happens whenever there is excess amount of the cortisol? It will lead to obesity. Now you might be thinking that cortisol is going to use fat for the energy, and how the person get obese? Right, the answer we are going to discuss in this slide. Despite free fatty acid mobilization and utilization, many people develop peculiar type of the obesity. How it will develop the peculiar type of the very particular type of the obesity? Because obesity is not related with the lipolysis, but it is due to increased food intake. This obesity is not due to lipogenesis, but it is due to increased food intake. Person cannot use glucose as a source of energy, so satiety center is not stimulated, so ultimately patient will eat more amount of the food. So yet fat is used for energy, but person will be eating more and more amount of the food, so person get obese. So fat generation is higher than fat metabolism and oxidation. Now what peculiar type of the obesity is there? What particular type of the obesity is that? You need to remember three things. One is the chest. There is excess deposition of the fat over the chest. Then buffalo like torso. The torso of a person will be like buffalo like torso. That is this region. And moon face. The person having a very round face. It is known as moon's face. Now one more thing that you need to remember is effect of glucocorticoid or the permissive action of a glucocorticoid. Yes, now what is permissive action? Glucocorticoid give permission to the other enzyme, other hormone to perform their action. So glucocorticoid is actually not responsible for that action, but little amount of glucocorticoid should be present for the action of that particular hormone. Let's understand that very thoroughly. A little amount of glucocorticoid must be present in the number of metabolic reaction to occur. Now although glucocorticoid is not produced that action by themselves, right? The action is supposed to produce by that particular other enzyme or the hormone. This action is known as permissive action. Let me repeat one more time. Some hormones are eventually perform their function. Now in order to make that function available by that particular hormone, they require little amount of glucocorticoid. Right, that glucocorticoid is actually not performing that function, but it gives permission to that hormone to get their action. Right, now let's give an example. First example is basically the catecholamines and glucagon. To exert calorigenic action of the effect of glucagon and catecholamines. So this calorigenic effect is done by glucagon and catecholamines, but some amount of cortisol should be present in order to make this calorigenic effect. Now the other example is the lipolytic effect of the catecholamines. So catecholamine is also perform lipolytic effect, but in order to perform this lipolytic effect, small amount of cortisol should be present. And the third one is the catecholamine to produce pressure response, that is the blood pressure effect of the catecholamines and bronchodilation. So basically there are very little amount of glucocorticoid should be present. That little amount of glucocorticoid will give the permission to the catecholamines and glucagon to perform their action. Now effect on bone. The effect of glucocorticoid over the bone. So what cortisol will do? It will increase bone resorption. How glucocorticoid will do bone resorption? It will increase activity of osteoclast and increase activity of collagenase. Now as you know, bone has a two type of tissue. One is organic material and another one is inorganic material. Right? Now it increases the activity of the osteoclast. So what osteoclasts do? Osteoclasts is basically dissolve the bone. And what collagenase do? It will break down the collagen that is present in organic portion of the bone. And it also decrease bone formation. So it will decrease collagen synthesis and also decrease formation of the osteoblast. And one more thing, it also increase the apoptosis. Yes, what is apoptosis? Apoptosis is cell death. It is programmed cell death. So cortisol will increase the rate of apoptosis of the two cells, that is osteoblast and osteocyte. It also decrease the calcium absorption through GIT and antagonizing the action of the vitamin D, and increase calcium excretion in urine. Now let me give you one more thing, that is, once you learn the action of the steroid drug and the side effect of that steroid drug are all the side effect or all the effect that is present in excess cortisol. So the more pronounced side effect of the steroid drug is that it causes bone fracture. Got it? Why it causes bone fracture? Because it increases bone resorption and decrease bone formation, and eventually it will do, excess cortisol will eventually leads to osteoporosis, weakening of the bone, and osteopenia. Got it? These two things it will do. It will do decrease bone formation and increase bone resorption. Now remember the effect of bone, right? It eventually causes the fracture. Now effect on blood cells. So there are the effect, it increases eosinophil level, it decreases the basophil number, and it decreases the lymphocyte count. So what it increase? It increase again three things. It will increase neutrophil, it will increase RBC, and increase platelet. What is the most important cell that you need to remember in effect of cortisol is the eosinophil. So cortisol and eosinophil count are inversely related. If there are more amount of cortisol, there are less amount of eosinophil. If there is less amount of cortisol, there is more amount of eosinophil. So let me give you one more thing. There is a diurnal variation occur in the cortisol level. That is, cortisol level is high in the morning and cortisol level is less in the evening. So exactly opposite will happens in the eosinophil count. Eosinophil count is low in the morning and high in the evening. Now from this very slide, one comment is actually asked that eosinophil count is low in the morning. So what you should write it down in such kind of comment? You have to write it down like that. And there is a diurnal variation that occur in the cortisol level, and the cortisol level will leads to decrease eosinophil count, and cortisol level is high in the early morning, so eosinophil count is low in that morning and high in the evening. Right? This is all about the comment that you should write it down in exam. Now facilitate maturation of the fetus. The action of a cortisol over the fetus is that it causes the maturation of a fetus. What it will maturate? It will maturate the CNS. It will maturate the lung. Maturation of the lung. How it will maturate the lung? It will access the production of surfactant. So if there are chances of the premature birth, the gynecologist will give the injection of the hydrocortisone to the mother. There are two injections of 25 mg at 24 hours apart. Now maturation of the GIT, it allows the fetus or the newborn to digest milk. Got it? This is all about our action of a glucocorticoid over the metabolism. Now in next lecture we are going to discuss about the effect of glucocorticoid over the